And then we'll be discussing about intestinal cestodes, cestoda infections, and intestinal cestodes, Taenia saginata, Taenia solio. And then we'll be discussing. And then we'll be discussing about cestoda infections, intestinal cestodes that includes Taenia saginata, Taenia solium, Hymenolopsis nana, Hymenolopsis dimicata, Diplydium caninum, Railietina garrison, extraintestinal cestodes that includes Echinococcus sp and Sparganosis. Cestodes infection, or intestinal cestodes, or tapeworms. Tapeworm infection contributes minor symptoms and it may lead to serious disease such as anemia and malnutrition. Taenia saginata. Parasite biology. It is ribbon-shaped and multi-segmented, and each segment has male and female reproductive system. Life cycle. Detach from tapeworm and migrate to anus, then pass to stools. Pathogenesis and clinical manifestation. Tapeworm infection is characterized by nausea or vomiting, appetite loss, epigastric or umbilical pain, and weight loss. Diagnosis. Parasite infection can be detected through stool analysis. Treatment. Luckily, treatments were widely available, and this includes niclosamide, paracequantel, and a new worm can regenerate if there is segment. That is why patient needs to be monitored for several months. Epidemiology. This parasite could be acquired by humans by consumption of raw or undercooked beef, which is common at Ethiopia and Argentina. They would grow to segments a day and proceed or produce millions of eggs per day. Prevention and control. Inspect beef properly, be sure it is properly cooked and at least 56 degrees Celsius throughout the flesh.
Taenia solium. Parasite biology. The adult worm inhabits the upper small intestine. It feeds on the contents of the host intestine just like the other intestinal cestodes. Um, Taenia solium. Taenia solium life cycle. First, humans ingest raw or undercooked pork containing sister cerci or larvae. After ingestion, seeds invaginate, attach to the small intestine by their scolex and mature into the adult worms in about 2 months. Adult tapeworms produce proglotids which become gravid. They detach from the tapeworm and migrate to the anus. Number 4, detached proglotids. Eggs or both are passed from the definitive host or human, for instance, in feces. Pigs or humans become infected by ingesting embryonated eggs or gravid proglotids, such as in fecally contaminated food. Autoinfection may occur in humans if proglotids pass from the intestine to the stomach via reverse peristalsis. 6. After eggs are ingested, they hatch in the intestine and release oncospheres, which penetrate the intestinal wall. Oncospheres travel through the bloodstream to striated muscles and to the brain, liver, and other organs where they develop into cysticercosis can result. Pathogenesis and clinical manifestation. So in intestinal infection, T. solium, intestinal infection results in mild and specific abdominal complaints. Unlike in T. saginata, proglottids are not as active and therefore obstruction of the bile duct, pancreatic duct, and appendix is unlikely. In cysticercosis, multiple cysticerci are common and they can be quite large. Inflammation may be caused by the live cyst. Cysts can live for up to 5 years. NCC or the neurocysticercosis is classified into two types, parenchymal and extraparenchymal, which are further subdivided into subarachnoid or meningitic, intraventricular, and spinal variants. The subarachnoid type of NCC can develop to racemose cysticercosis, an aggressive form of the disease. Cysticerci are most commonly found in the retina or subretinal layers of the eye. Chorioenteritis and vasculitis usually cause vision problems. Intraorbital discomfort, photopsia, and blurring or loss of vision are all possible symptoms. Diagnosis. In intestinal, the proglottids, eggs, or scolex are reported for T. saginata are used to make a specific diagnosis for tyanesis. In cysticercosis, for locating cysticerci and analyzing the pathology before and after treatment, computed axon tomography or CAT or CAT scans, and nuclear magnetic resonance imaging or MRI are helpful. Muscle and subcutaneous cysticerci undergo histopathologic processing such as tissue biopsy, serologic assay for specific immunoglobulin G and immunoglobulin M, anti-cysticercal antibodies include serum and CSF enzyme-linked immunosorbent assay or ELISA, electroimmunotransfer diet or EITB or Western diet. The DOTELISA or DOT ELISA test is an excellent cysticercosis screening test. Recent research is now looking into the usage of cysticercosis cellulose antigen B as a diagnostic aid. Treatment. In intestinal, the drugs of choice are praziquantel and niclosamide. Praziquantel is given as a single dose of 5 to 10 milligram per kilogram to both adults and children. Niclosamide isn't really readily available in your area. The following are some of the key criteria. First, regaining control of the scolex. Number two, a stool examination that is negative. Number three, months following treatment, be monitored for several months as egg-bearing segments can resurface in 10 to 12 weeks. In cysticercosis, praziquantel at a dose of 50 to 75 milligrams per kilogram divided into 3 doses for 30 days, or albendazole at a dose of 400 milligrams twice daily for 8 to 30 days are used to treat multiple parenchymal cystic lesions. 4 hours after the last dose, steroids are administered. When there is a rise in intracranial pressure, mannitol is used. Some specialists advocate surgical removal of the lesions in the subarachnoid form, while others recommend albendazole therapy, which involves giving albendazole at a rate of 10 to 15 milligrams per kilogram each day for 8 days. Surgical removal of symptomatic cysts outside the CNS is an option. Epidemiology. Abstinence from beef as part of the religious beliefs among the Hindus prevent T. saginata infections, while among the Muslims, prevention of T. solium infections happens because of the abstinence from pork. Both tapeworms have a cosmopolitan distribution, although T. solium is especially common in Slavic countries, Latin America, Southeast Asia, China, and India. By the adult morphology, the so-called Taiwan or Tayania resembles T. saginata, but by the appearance of these cysticercles, it is close to T. solium. In the current taxonomy, this parasite is known as the Tayania asiatica. In the Philippines, T. saginata infection is more common than T. solium infection. Many of the identified cases were adult males who came from the northern Luzon provinces and were eating raw or undercooked meat while drinking alcohol as a delicacy. Neurocysticercosis has been reported in local literature. There has been one report of ocular cysticercosis. Prevention and control. Tyniasis prevention and control may sound straightforward, but they can be challenging to put into practice. A basic measure is to thoroughly cook the meat. The cysticerci are killed by freezing them for 10 days at negative 20 degrees Celsius. All slaughtered pigs, cows, and cattle should be inspected for um, some reasons.
Hymenolepsis nana. Parasite biology. The cystoid or tapeworm Hymenolepsis nana is the most common cause of hymenolepiasis, the dwarf tapeworm adults measuring to 15 to 40 millimeter in length. Pathogenesis in clinical manifestation. This illness does not require an intermediate host and can be transmitted directly from one infected individual to another by fecal-oral transmission. Those who have symptoms may experience nausea, weakness, loss of appetite, diarrhea, and abdominal pain. Diagnosis: the presence of eggs in routine fecal flotations or adult worms in the small intestine can be used to diagnose Hymenopteris nana. Treatment includes praziquantel and adults and children for about of 25 milligrams in a single dose therapy. Niclosamide, adults 2 grams in single dose for 7 days, and children for about of 11 to 34 kilogram is 1 gram in a single dose in 1 day, then 500 milligram per day orally 6 days. Children greater than 34 kilogram is about to 1.5 grams in single dose in on 1 day, then 1 gram per day orally for 6 days. Nitazosanide, adults 500 milligram orally twice daily for 3 days. Children for about 12 to 47 months should have a 100 milligram orally twice daily for 3 days. Children for 11 and 4 to 11 years old should have 12 milligrams orally twice daily for 3 days. Epidemiology. Hymenopteris nana has a worldwide distribution and is thought to be the most prevalent cestoid parasite in humans. Particularly among children, the global incidence ranges from less than 1% in the United States to almost 9% in Argentina, with a global prevalence of 14% on average. Prevention and control: after using the restroom, changing diapers, and preparing meals, wash your hands with soap and warm water. And in order to avoid infection, teach, teach children the necessity of washing their hands. Before consuming raw vegetables and fruits in Asian, where food is like to be contaminated, we need to wash, peel, or cook them with clean water.
It is known as rat tapeworm is a species of Hymenopteris tapeworm that causes hymenolepiasis. It is slightly bigger eggs and proglatids than H. nana and infect mammals using insect as intermediate host. Hymenolapis diminuta is prevalent worldwide, but only a few hundred human cases been reported. Few cases have ever been reported in Australia, United States, Spain, and Italy. Parasite biology. Cosmopolitan in distribution and rarely infect humans. Infection is infrequently because of the obligate need for an arthropod intermediate host in which the cysticoid larvae develop. Human infections usually occurs following the accidental ingestion of infected beetles that contaminated grain or cereal products. A common parasite of rats throughout the world occasionally parasites human. H. deminota exhibits a typical two-host life cycle, utilizing a grain-ingesting insect such as flour beetle as intermediate host. A single worm may reach a length of 90 centimeters. Pathogenesis and clinical manifestation. H. demenota is thought to be passed to humans most often through the ingestion of insects in dried grains or cereal. Research done in 2000 shows that of 9 pet stores surveyed in Connecticut, USA, 75% sold cats. 75% sold rats, mice, or hamster infected with H9. A serious public health risk could result from pet store parasites transmissions. H. demenota is thought to be passed to humans most often through the ingestion of insects in dried grains or cereal. In H. demenota, this stage occurs only in grains beetles. It lasts about 5 to 6 days, then the worm matures and attaches itself to the last part of the small intestine. Life cycle of Hymenolapis demenota is passed out in the flesh of the infected definitive host. The mature eggs are ingested by the intermediate host, and ocosphere are released from the egg and penetrate the essential walls of the host, which develop into cysticercoid larvae. Diagnosis. Diagnosis for hymenolpiasis is done by examining stool for eggs. The proglottids that are disintegrated in the intestine cannot be detected. Egg output can be sporadic, so a couple of stool tests a few days apart may be needed to diagnose the infection. Hymenolapis diminota is 20 to 60 cm in length. Human infection is usually asymptomatic, but it can cause mild gastrointestinal symptoms. Diagnosis is by finding characteristic eggs in stool. A stool sample should be repeated 1 month after therapy is complete to verify cure. Treatment. H. demenota infected is effectively treated with praziquantel. Alternatives include nitazoxamide and niclosamide. Epidemiology. In human, infection with Hymenolapis nana are much more common than infection with Hymenolapis diminuta. H. nana is the most common cause of all cestoid infection and is encountered worldwide. In temperate areas, its incidence is higher in children and in institutionalized groups. H. demenota is less frequent but has been reported in various areas of the world. Parasitation rate ranging about 0.001 and 5.1%. H. demenota infection in human is rare, typically occurring in isolated cases. Several studies of H. demenota exist as case reports describing a single affected individuals. Isolated cases of H. demenota from Spain, Russia, and Eastern Europe have been recently published. Prevention and control. Rodent control in areas in which grain products are produced or stored is essential. A thorough inspection of uncooked grain product to detect mealworm is also important. An effective prevention and control program should include the purchase of parasite-free animals, insect control and high standard, good hygiene, public health and sanitation programs, and elimination of infected rats help to prevent the spread of Hymenolapiasis. Preventing facial contamination of food and water in institution and crowded areas is of primarily importance.
Dipylidium caninum. Parasite biology. The parasite D. caninum or dog tapeworm is common in household dogs but seldom affects children. It is spread by swallowing fleas with parasite sister sarcoid larvae. Humans are seldom infected with canine tapeworm, but parents who find troglodytes crawling in their child's diaper will naturally seek medical treatment. Praziquantel is used to treat the patients. Dog tapeworm are a kind of echinococcosis. The consumption of eggs from Echinococcosis granulose, Echinococcosis multilocularis, or Echinococcosis vocale causes severe illness due to the formation of hydatid cysts, pathogenesis, and clinical manifestation. The majority of Dipylidium caninum infections are asymptomatic. Animals could act in a way that help to relieve anal pruritus, such as scraping anal region across grass or carpeting. There is a chance of minor stomach issues. The most visible characteristic for both animals and children is the movement of proglottids. These can be found in the genital area, human wastes, nappies, and occasionally on floorings and furnitures. The proglottids are motile when freshly passed and might be mistaken for maggots or larvae. Because people don't consume fleas very often, colonization is restricted. There are no symptoms caused by a low quantity of dog tapeworms. Approximately 20% of infections have a greater parasite load and become symptomatic, presenting with stomach discomfort, diarrhea, and in rare cases, fecal incontinence. D. caninum is detected when children or their parents discover mottled proglottids crawling in their diapers, underpants, or feces. Diagnosis. The diagnosis is obtained by observing the common proglottids or egg packets in the feces or environment. So the treatment for both animals and humans is simple and highly effective. Praziquantel can be administered orally or intravenously for pets only. The drug dissolves the tapeworm within the intestines. The worm may not be evident in the dog's feces since it's normally consumed before passing. In general, these medications are well tolerated. Epidemiology. D. caninum is the most common tapeworm in domesticated dogs and cats. It is found around the world. People become infected with dog tapeworm by unwittingly eating infected fleas. The majority of incidents involve newborns as well as the little children who have frequent interaction with their pets. Prevention and control. If a pet has a determined dipylidium infection, there are various anthelmintic treatments available to treat it. They comprise active components with broad spectrum antimicrobial properties such as benzimidazoles. Examples are febendazole, febental, mebendazole, or certain tynicides such as praziquantel and epsipental, the latter commonly in combination with nematicides. Examples are levamisole and milbemycin and pyrantel.
Rhylitina garrisoni. The parasite biology of Rhylitina is a large cestode genus or family Divinidae with hundreds of species found in a variety of vertebrate hosts. It has the potential to produce infrequent or harmless infections in people. The majority of human infections are caused by R. silibensis, as well as several synonyms. So, example given are R. formosona, R. garrisoni, and R. madagascariensis. So, R. demiriarensis. So, there are also cereraji. Rhyletina spp or multiple species is a genus of Rhyletina spp. So inner meat capsifer or Madagascarsiensis is a common misidentification. So the precise identity of the zoonotic Rhyletina spp intermediate host is unknown. Several ant species, ground beetles or the family of Carabidae, scarabeetles or the family of Scarabaeidae, and darkling beetles or the family of Tenebrionidae act as intermediary hosts for other Rhyletina multiple species. Pathogenesis and clinical manifestation. So most occurrences are likely asymptomatic. However, the appearance of white motile proglottids in the stool usually attracts medical attention. However, gastrointestinal troubles and other ambiguous complaints, example is irritation and nausea, have been mentioned in published case studies. Almost all of the known incidents have involved young children. The small intestine is where the mature parasite lives. In most cases, infection is asymptomatic and no clinical illness had been reported. So it is the Rhyletina species with the least pathogenic potential. Pathological signs of large loads of experimental infections include epithelial cell degeneration, enteritis, and macrophage infiltration of lymphocytes. So, however, among published case reports, gastrointestinal disturbance and other vague complaints had been described or there are nearly known cases have been from young children. Diagnosis. So the diagnosis is usually made after the body has been autopsied. A representative number of birds should be examined with mucosal scrapings microscopically examined to discover smaller related tapeworm species. Example is the Vinia proglottina. Gravid segments can also be found in sick birds' excrement but not in their eggs. Treatment. Anthelmintics that are effective against tapeworms can be used to treat flocks at risk. They comprise either broad-spectrum benzimidazoles, example is albendazole, fibantel, and fenbendazole, or particular tannicides. The majority of these active substances are available as feed or drinking water additives or as tablets for oral administration. So warning, niclosamide is poisonous to geese, and praziquantel combined with pyrantel tartare is poisonous to chickens. So other traditional cattle anthelmintics such as microcyclic lactones, levisamol, tetraitopyrimidines, and piperazine derivatives are completely ineffective against Rhyletina or any tapeworm. So the epidemiology. Rhyletina multiple species is a genus of Rhyletina spp exists in a wide range of animal hosts, but only a small percentage of these are likely to be zoonotic. R. sibilensis and Cirrhoraji are thought to be found only in the Asia and the Pacific. Rhyletina celebensis has been found in humans in East and Southeast Asia, the Pacific Islands, and once in Australia. R. cirrhoraji has only been reported from Thailand, while R. demiriarensis is a New World species with solitary cases reported from South America or most notably Ecuador, Central America, and the Caribbean. Prevention and control. It's a good idea to take precautions to avoidant or beetle contamination of the meal. Fly control is also suggested for the same reason, so the use of insecticides against ants and beetles outside, however, is not justified on both economic and ecological grounds. When slugs and snails are involved as intermediate hosts, changing the bird's bedding on a regular basis and keeping it dry can assist to avert infections by shortening the egg's lifetime and making it unappealing to slugs and snails. Because slugs and snails thrive in humid areas, thus free-ranging birds should be kept away from them.
We have extraintestinal cystodes, extraintestinal infection with larvae results from ingestion of eggs of fecal region. So extraintestinal manifestations include cystic cirrhosis. Wait, langly what? So we have extraintestinal cystosis, extraintestinal infection with larvae results from ingestion of eggs of fecal origin. Extraintestinal manifestations include cystic cirrhosis that can affect any organ. Hydatidosis can affect any organ, but typically the liver and lungs. And the neurosector cirrhosis affecting the central nervous system. So example of this is Echinococcus um, granulosus. So canine small intestines are home to the adult worm. It has piriform skull legs and a short neck, and three proglutids, one immature and one mature, and also one gravid. It is uh, 3 to 6 millimeter in length. The skull legs has four acetabula, which is typically thionids. It has 30 to 36 hooks on it. The gravid proglutid is the widest and longest of all proglutids. So it is possible that eggs will be released whether inside or outside the host. So the eggs are eaten by intermediate hosts who are suitable, such as goats, horses, for example, as well as camels and sheep. Hatch in the duodenum, then male may potentially inadvertently consume the eggs. So the oncospheres breach the intermediate host intestinal wall and travel into the mesenteric venules, where they finally lodge in various organs and the tissues. Hydatid cysts, the larval stage, are generated through central vesiculation and steadily grow in size. It may take 5 months to attain a size of 10 millimeters. The cyst may include a large number of protozoolisis, with carnivores or omnivores consume cysts in tissues, so development is complete. So protozoolisis can be released if the brood capsule ruptures. So it is also called hyatid sand. Hence the term of for protozoolisis and brood capsules that are free in the cyst. Is a pathogenesis and clinical manifestation. So the growing larval cysts in the tissues of the intermediate host causes pathology. So the cysts of Echinococcus granulosus are called unilocular hydatid cysts, while those Echinococcus multilocularius are considered alveolar cysts. So cysts are simple or uncomplicated, may not cause any symptoms. So hepatic cysts are most commonly detected in the inferior right lobe of the liver and can induce obstructive jaundice. So when abdominal cysts are large enough, they might cause discomfort. Okay. Diagnosis. In order to diagnose echinococcus, radiographic findings or ultrasonography must be paired with a history of living in an endemic location and close interaction with dogs. So, indirect serologic testing, such as the use of indirect serologic testing, are examples of positive serologic tests. Supplementary tests includes hemagglutination, indirect fluorescent antibody, and enzyme immunoassays. So these tests can be used as screening tests and have sensitivities ranging from 60% to 90%. So for confirmation, positive cases will be subjected to a gel diffusion assay and will reveal the echinococcal. So treatment. Surgical resection is still the treatment of choice for echinocosis, despite the fact that surgery is not 100% effective and can cause a number of problems. So, albendazole 400 milligrams twice a day for 1 to 6 months in 4-week cycles with 2 weeks of between cycles. It is also used to treat inoperable cyst after surgery. Albendazole is also suggested to prevent cyst recurrence. Epidemiology: Australia, New Zealand, Northwest China, and United States are among the countries with a high incidence. So Southern Europe and Middle East and South America are three of the world's most populous regions. Locally acquired cases have been reported in some states in the United States. So ingestion of eggs is the most common way for children to become infected. Eggs on hands could have come from the dirt of or a dog's fur. Prevention and control. Prevention is accomplished by lowering infected populations and limiting transmission opportunities. Tinifuges should be administered to dogs in endemic areas once or twice a year. So dogs should not be allowed in slaughterhouse, and trash from such establishments should be sanitized to reduce the risk of transmission.
Sparganosis. Parasite biology. Sparganosis is caused by the infection of a pseudophylidron cestoid of the genera Sperometra and Sparginum with their third stage Plerocercocoid larvae or Sparginum. Pathogenesis in clinical manifestation. The mass effect is what caused the symptoms: weakness, headaches, convulsion, numbness, tingling, or strange skin sensation can all be symptoms of Spargana tumors in the central nervous system. Diagnosis: the larvae detected in tissue sample are used to provide a definitive diagnosis of sparganosis. The presence of eosinophilia confirms the diagnosis. It's possible to find antigen-specific and IgG antibodies. Treatment includes Sparganar surgically removed. The disease can recur if all sections of the worm, including the solex, are not removed. Proliferative sparganosis may be only cured through surgery. Epidemiology: sparganosis in endemic or possibly endemic in 48 countries, with cases reported in Asia, Africa, Australia, South America, and United States, albeit infrequently. Prevention and control: the ingestion of raw or undercooked frog and snake flesh, drinking contaminated water, and applying raw frog flesh or skin to open wounds are all essential factors in preventing human sparganosis. And these are our references.